So now let's just take a couple of minutes to look at just some basic economic principles and how they relate to health economics, healthcare. So the first term is scarcity. We don't have unlimited time. We don't have unlimited money. We have scarce resources. And because of that, we need to make choices. And with health economics, with healthcare, we have a limited amount of money. And so if our healthcare costs keep rising, well, then that money needs to come from somewhere else. Opportunity costs. Opportunity cost is what you give up in order to get something else. It's the full cost of it. And when we look at it from a healthcare point of view, an example of an opportunity cost, let's say you're going to the doctor, or you want to go to the doctor. The opportunity cost of a trip to the doctor is time at work. Okay, so in order you make choices, you don't have a limit time and money, and the opportunity cost is what you're actually giving up. Willingness to pay it's a measure of how much you're willing to pay for something. And when it comes to your health care, people are willing to pay a lot. We've talked about how healthcare costs have been going up and up. People continue to pay for it. Right? They continue to buy insurance. They continue to go to the doctor. Why? Because they value it highly, and so they're willing to pay a lot for it. Trade, in order for any transaction to be, or trade is where you give something and you get something. Oops. You give something and you get something in return. So, for example, with the doctor, you go to the doctor, you get money in return. Money flows in a circle we talked about. All money that you pay goes to the doctor. All money that goes towards healthcare has to come from somewhere. Now, not all health decisions are just yes or no. It's always, do I want to go to the doctor or not? So a lot of times we have to look at the margin. Right? Sometimes we have to look at how much of a medication should we get? Should I take 1 Tylenol or 2 today? 2 or 3? 3 or 4? Not only that, but we also have to look at some health decisions by type of treatment. And so, do I not want to get any treatment, or do I want to get treatment A? Treatment A or treatment B? Treatment B or treatment C? Now, when making these decisions, we look at the margin, right, which is the additional cost of an additional unit of something or additional option versus the additional benefit. So when you look at the margin, you look at, for example, with Tylenol. Let's say you're just trying to decide if you don't want any Tylenol or one. So you look at the benefit you get from that first Tylenol, and you also look at the cost of that first Tylenol. All right, so you say, all right, yeah, I want to have the first. Do I want to take a second one? When you do that, the question is, all right, what is the benefit I get from the second one? Not from 2, but just from the second. And what is the cost of the second? So when you look at that, you want to maximize your total net benefit. But in general, with any kind of a decision, and in healthcare, choices come down to benefits and costs. If you get more benefit than costs, you're going to do it. Some other economic tools. Investment. Investment is, in a very general sense, spending today so you're better tomorrow. In healthcare, or within health related, why do people go to the doctor? Well, they go to the doctor, why do they get yearly checkups? Well, they get checkups to try to prevent them from getting sick later on. Right? They get checkups to make sure that if there's an issue, they're going to catch it early. So you're investing in yourself by going to the doctor for just a regular checkup. Contracts, basically we look at insurance contracts that are very complex. It's timing, there's risk involved. And we'll talk more about that with insurance. Now, organizations, both on the insurance side and on the provider side, are constantly adapting and evolving. When the Affordable Care Act was enacted, these facilities, these companies, they needed to adapt. Now, the other thing is distribution. Who gets what? Who gets the healthcare services? Clearly, in this country, it is not everyone gets the same amount of healthcare. Okay? Not everyone gets the same benefits. So if we look at this, and we look at the disparities, we have two groups here. We have middle-aged men, and we'll look at white middle-aged men and black middle-aged men. And these are mortality rates, annual mortality rates among this cohort. So when we look at this and we compare it to income, you can see that for both groups, what happens? Well, as they make more money, both the white males and the black males, same age group, have a lower mortality rate. So what does that tell you? Basically, in a very broad sense, this is telling you that as people have more money, they're less likely to die. Now, that's not necessarily just because of healthcare. Lifestyle plays the biggest role in how healthy you are, and the more money you have, the healthier lifestyle you can live, and so that's a big factor as well. But this is still just a general idea to look at, with the basic idea that money does play a huge role in how healthy you are. Now, when it comes to healthcare, choices are made on different levels. They can be made on a personal level, a group level, or a public level. So, for example, if you want to go to the doctor or not, it's your choice. Okay? You decide. However, not everything is you. Sometimes decisions are made on group levels, and on the group level, you have your insurance companies. Your insurance company can tell you if you can or cannot go to the doctor. You can say, all right, I want to go see this doctor. They can say, no, they're not in the network. Or, no, you don't have prior authorization. All right, so in that case, the group, your insurance company, can make decisions for you. Health choices are also made on public levels. And the public levels are really when society makes decisions. And an example is smoking bans. And so in restaurants, in most areas now, you cannot smoke anymore. You may want to smoke, that involves your health, but they can say, no, you can't do it. Now, it's not that simple. They're not just telling you what to do. There's also the well-being of others that come into play with secondhand smoke, but that's where the public decisions do come in. The last thing that we're going to address during this semester is the idea of rational choice theory. And in general, we assume that people are rational, okay, in economics. We assume that if they're not going to benefit from something, they're not going to do it. And if they will benefit, they will do it. It doesn't always hold up. There are times when people don't make the best decisions. They're not rational. But in general, we assume that's the case. And so those are the basic terms, economic terms, that will be applied throughout this course.